Welcome to Raising Mommy. On this episode of Raising Mommy, I sit down with retired law enforcement officer Tanya Smith. We have a very intimate conversation about the opioid crisis, including candid details about her own personal struggle with losing a daughter to drugs. Check it out to find out the number one thing parents must do to keep their kids safe from this crisis. A special thank you to our friends at Emory Women's Center at Findley for sponsoring this episode. As part of Emory Healthcare, the largest and most comprehensive hospital system in Atlanta, Emory Women's Center at Findley offers women the highest level of care. Whether you're looking for a gynecologist for your annual well woman checkup, an obstetrician for pregnancy care, or a reproductive health specialist, Emory Women's Center at Findley is known for outstanding women's health care. Our physicians provide general gynecological care for women of all ages, including all dimensions of pregnancy and prenatal care, as well as preventative women's education and management. You can depend on unparalleled medical care delivered by specialists who will work with you to develop a personalized treatment plan. For patient appointments, call 404-778-3401. Emory Women's Center at Findley is located at 12,000 Findley Road, Johns Creek, Georgia, 30097. Today's episode is also sponsored by the Little Gym of Alpharetta and Johns Creek. At the Little Gym of Alpharetta and Johns Creek, we specialize in unique educational classes that revolve around enrichment and physical development for children's ages 4 months to 12 years. Programs offer children a springboard to life's adventures by using movement-based learning and imaginative play to help build the confidence and skills needed at each stage of childhood. To learn more, visit thelittlegym.com/Alpharetta Johns Creek GA or RaisingMommyPodcast.com. Enjoy the show. Welcome to Raising Mommy, a podcast sanctuary where moms can come to listen, share, learn, and grow. I'm your host, Kimberly Tyson, vegan blogger for EatPlantsForLife.com, wife and mom of 2. On today's podcast, I have the pleasure of speaking with Tanya Smith, Director of Victim Services at Kennesaw State University in Kennesaw, Georgia, a division that she created. She is recognized for her work in building the first Victim Services Division at KSU and implementing the first opioid overdose prevention program for law enforcement in the state of Georgia. She is an advocate for the 911 Amnesty Law, which we will talk about in just a few minutes. Welcome to Raising Mommy, and thank you for being a guest.
Hi, thank you for having me.
Today's Real Chat segment is titled The Opioid Crisis. Tell us your professional background.
Well, I started in law enforcement 24 years ago. I spent most of my time in criminal investigations. I rose to the rank of lieutenant before retiring from municipal policing in 2014 to start the program at Kennesaw State University.
Okay. So according to the CDC, each year, 130 people in the U.S. die after overdosing on opioids, including prescription painkillers, heroin, and synthetic opioids, including fentanyl. The Centers for Disease Control and Prevention estimates that the total economic burden of prescription opioid use in the U.S. costs $78.5 billion a year in healthcare costs, lost productivity, addiction, treatment, and criminal justice involvement. But most importantly is the emotional cost to the families involved. You can attest to that. Tell us about Taylor.
Taylor was my youngest daughter. She was 18 when she became addicted to heroin. She didn't. Most people who try drugs and experiment and become addicted spend years in misery. She only lasted 2 years, so it was a rather short journey for her through addiction. But in that short time, it was the quickest. I don't even know how to describe it. I've never seen something deteriorate so fast. So fast. Taylor graduated high school in May of 2011, and she was an addict by August of 2011. It was that quick. Her first arrest came in August, and that's when I found out. In May, she was not addicted to anything. She wasn't using anything. She was beautiful, brilliant. She had this whole life ahead of her. She was one of those people. And I know all parents talk about their children all the time, in this best light. This is literally, I mean, this is how she was. She could light up anything. She could light up any room. She had a quick wit. One of those people that she would say things and you'd say, where did she get this from? Where did this come from? How did she come up with that? Loved to sing, couldn't sing a note and didn't care, could not care less. She would sing for an audience. She didn't care, belt out gospel tunes. She loved them. So it was just, it was a shock. It was a shock. But when she was in high school, all throughout her life, Taylor's first experience with pain medications came when she was 6 years old. She had oral surgery. And, not only did she have her gum cut open, the surgeon accidentally nicked her lip, and she had a scar on her lip. So that was her first experience with pain meds. She was a lifelong cheerleader, so she was constantly getting hurt. She suffered from asthma, so doctors were daily routine for her. So she was very used to the medical community and comfortable with doctors. Doctors were authority figures. So when she was introduced to pain pills recreationally after high school, when she no longer had a legitimate injury to use them, it was perfectly normal for her. She didn't think anything about it. I mean, they're prescribed by doctors, right?
Right.
So, but it quickly deteriorated to heroin. And then she was very open, very honest with me throughout the entire journey. She would lie, of course, to get money,
Right,
to fuel her addiction, but she was very open about her addiction. And she came to me one day, it was about 2 weeks before she passed away, and she told me that a girlfriend had told her if she would switch to methamphetamine, that it would get her over her addiction with heroin. She would no longer crave heroin, which was the hardest battle for her.
wow.
And, I didn't understand. I thought once you detoxed, once you went through that 3-day disaster, it's the worst thing that you ever watch anyone go through, that she'd be fine. And she kept telling me, no, the cravings were still there. So, and that's what ultimately killed her.
Wow. I think when people think of a drug user or addict, they always have this profile of someone that's in poverty, inner city, maybe someone homeless, but you say that that's not the case.
That is not the case.
Tell us about Davis.
Davis, I only know through my relationship with his mother. He passed a few months after Taylor. He passed in March of 2014. Davis was not only exceptionally intelligent, brilliant, high grades valedictorian, he was a community advocate. I mean, he was out there in the community doing things, helping people. He had over 500 of community hours when he applied for college. Wow. So just an exceptional young man. And he turned to heroin after a battle with prescription pills. But his use of prescription pills came from the pressures at the university, studying, staying up all night. He would binge to study, cram for exams, stuff like that. So he got into his mom's pills, her medicine cabinet, and used some of her pills so he could sleep to come back down from that, from that excessive studying. And again, once the stash wore out, once the supply wears out, it's gone, they turn to heroin. So pain pills on the street run $80, $90, depending on what kind you're getting. heroin's $10, you know?
Wow.
So, and it does a lot to the body, the same as a pain pill. So they get that same feeling, that same, what they're looking for, but it's a lot cheaper. So Davis, his journey, he was another one that unfortunately didn't have very long to fight. It took him rather quickly as well. And he was found in the parking lot at a Hooters where he met his dealer and got his last stash. So tragic.
That is tragic. So you are a big advocate for the 911 medical amnesty law. What is that and why is it so important?
Well, let me start with why it's important first,
Okay.
because this is how I got involved with advocating for this law. So what was happening across the country, not so much anymore, but what was happening, especially in Georgia, is when someone was overdosing, their friends would panic, especially the younger friends would panic and not want to get in trouble, especially if they're from an affluent family, that this is going to bring negative light on their family if they're arrested. What if their dad's an attorney? What if their dad's a judge? This was happening. And so I was contacted by a group, by a young man that was leading this charge, and asked me if I would read this bill because when Taylor passed away, that is what happened to her. That is what happened with her friends. They panicked because they still had meth. So what they did was they waited until she was gone, washed her body, loaded her in a pickup, drove her to another location to an abandoned trailer, dumped her on the side of the road, and drove away. And that's what was happening. When this happened, I was so ignorant to what was going on in this country, had no clue to how bad it was. I thought Taylor was the only one.
Wow.
I really did. That's this little bubble that I was in, even in law enforcement. I thought she's the only one that this has happened to.
Mm-hmm.
And when this young man contacted me, he called me because he was given my name and said, listen, if someone can help you with the law enforcement community, because you're about to overturn a long time existing law that's prominent in the war against drugs. You're about to overturn possession, you know? So if anyone can help you, she can help you because she just lost her daughter for exactly what your group is advocating for. So he sent me the law, and I thought this was brilliant. You know, Taylor would be alive if this law was. Maybe she wouldn't be alive. I can't say that now. Maybe she would have eventually lost her fight, but she would have been alive that night.
Right.
She was less than a mile away from a hospital, maybe 1 point something miles away from a hospital. So in the time that it took them to look for a location to dump her body, they could have taken her to a hospital.
Right.
So that's what was happening. And I met this group of mothers, and there were so many of them. And I was blown away. I was like, you know, you've got to be kidding me. These are parents who had sent their children to Pace Academy, who's, you know, they lived here in Alpharetta. They lived in Buckhead. They were doctors, lawyers, nurses.
Wow.
And I was like, I felt like, you know, the lowest socioeconomic of the group representing law enforcement. Not to say anything about law enforcement, but
Right.
you know, they just don't make a lot of money. I mean, here were people who had spent hundreds of thousands of dollars on their children's rehab, and they still lost him because someone was too scared to call 911. That's why this law is important. You need to take that fear away. And give a person that peace of mind to call 911 to save that person's life. You know, that may be that one moment. This OD may be the one that turns it around for them, that they actually go get substantial help, you know? But that wasn't happening. So that is why this law is so important. And what this law does is it gives limited immunity for possession of drugs up to certain amounts. So for marijuana, it'll be up to an ounce. For a solid substance, up to 4 grams, which is a lot. It's a lot. It grants immunity even if the person is on parole, even if they have a temporary protective order against them, if they're on probation, if they're out on bond. It provides protection regardless of those circumstances. And it actually also provides protection for a minor who may be in illegal possession of alcohol at the time that they call 911. So basically, as long as you seek medical attention for you or someone you're with that's experiencing an overdose, you're going to be protected under this law. You don't have to worry about being arrested or being prosecuted or mom and dad finding out.
Right.
You know, the drugs are going to be seized, the alcohol is going to be seized, but you're going to be able to walk away. And then the second thing that it did is it actually gave access to naloxone for law enforcement officers. So it recognized them as a first responder, which we've always been first responders, but not first responders that carry a drug.
Okay.
So at the time that this law was written, naloxone was still on the schedule list. So it had to be, you could only possess it through a prescription. So, I mean, that was huge. That was huge for us. We're often there first, especially when you get to some of these outlying areas that don't have ambulance service, you know, around every block or police around all the time. You know, it takes a little bit while. It takes a little bit longer for emergency services to get there. So police are usually there first. And you think about these parents walking into these homes, especially where there's a young person that is OD'd. They're turning blue, their lips are purple, they're on the floor, they're not breathing, the parents can't do anything, they don't know CPR, and a cop walks in, and CPR is not going to help. CPR is not going to do anything for that person that's overdosing. And these parents are standing there looking at these cops going, why aren't you doing anything? Do something. This is what you're supposed to do. Save my child. And police, before this law, were just like, there's nothing I can do. I'm sorry.
Wow.
We got to wait. We got to wait for EMS. An overdose takes about 4 to 6 minutes to kill someone. That's not a long time.
Right.
You know, especially when an ambulance may be on another call and they're 10 or 15 minutes away, their backup is.
So for those who don't know, what is naloxone?
So naloxone is an opioid antagonist.
Okay.
So what opioids do is they cause respiratory depression, which results in death. Like I said, usually in about 4 to 6 minutes, depending on the amount ingested, depending on the person's tolerance level. It could be a little bit longer, but usually you're looking at about 4 to 6 minutes. So what naloxone does is it binds to the opioid receptor better than that opioid does, and it kicks that opioid off. So it starts to restore the person's breathing, and that gives you time for EMS to get there and to do more advanced life-saving stuff.
Measures. So is this something that the EMS usually has with them?
Oh,
but
yes.
you want officers to have it because they usually get there quicker sometimes. Is it something that's costly? Is that the issue, or?
It can be. And there for a while, for a couple of years, there was some price concerns because as this program took off across the country and more law enforcement were purchasing naloxone, there started to be a shortage. So it went up. Now we can get it, law enforcement can get it for about $40 a kit, which is not bad. There are different, there's different makers of it. There's different administration techniques for it. There's injectable, there's nasal. So they vary in price, but usually around $40.
So if heaven forbid if this ever happened, but if I'm a mom who has a child struggling, can I get it too? Or is it just something that is for professionals?
No, thanks to Governor Deal, there's now a standing order that makes it accessible for anyone without a prescription.
Okay.
So it's no longer. And if you have children, eventually they're going to get hurt. You know, eventually they may have oral surgery. They may have some type of other minor surgery. Even if you're not dealing with an addiction issue, if you have pain meds in your house, you need to have naloxone because you never know.
Okay.
It could just be that one time that, and this was happening a lot with elderly, we found in a lot of the overdose responses that we went to for the elderly, they would forget that they had already taken their medication.
Mm-hmm.
So they take an extra dose. Or, you know, family members not watching them, paying attention.
Right.
And then you've got an overdose situation. So you need to have naloxone. If you've got opioids in your house, you need naloxone in your house as well.
Okay. So, fentanyl.
Mm.
Now that I was reading that heroin is now being laced with fentanyl, and how is that more dangerous?
It's not just heroin. They're cutting cocaine, meth. They're speedballing, which is the combination of heroin and meth. They're making pain pills that people think they're taking oxycodone or Percocet, and it's actually fentanyl. So it's not just heroin. It's such a dangerous drug, not just for the people who are consuming it, even if they do know that they're taking fentanyl, but for law enforcement, for people who are going to come to this person's aid,
Mm-hmm.
because fentanyl is so easily absorbed into your skin. You can breathe it in, or it can absorb through contact with your skin. That makes it very dangerous. So
Right.
if you're a mom and your child has a drug that's been cut with fentanyl and you go to help them and that drug is still exposed, you breathe it in. So now you've got two people that are going to overdose. It's 100 times more potent than morphine.
Wow.
Again, depending on a person's tolerance level and how much they ingest, they may have only 30 or 60 seconds after fentanyl is absorbed that they're dead. It actually reaches an opioid receptor quicker than heroin does and binds more solidly. It's harder to knock off, which means it takes more naloxone. So when we respond to a suspected fentanyl overdose where naloxone's already been given maybe by someone in the house that has, like I said, they've got naloxone because they've got a pain pill, and it hasn't worked, and we get there, we know we're going to need 4, 5, 6 kits. I've heard of it taking as much as 8 to even get a response from someone who has consumed fentanyl.
Wow.
So it's very dangerous. For families who have someone with a terminal illness, that fentanyl has been given as an end-of-the-life pain treatment to make them more comfortable. It usually comes as a patch. What we see is that kids are taking those patches and scraping that gel off and using that to get a better high than heroin gives them.
Wow.
So it's extremely dangerous.
In all of your research and your history in law enforcement, has anything surprised you about the opioid crisis?
What surprised me, what was the most shocking, is to find out how it started. It started in 1980 with a simple statement in the New England Journal of Medicine that was taken out of context and cited over 600 times, saying that opioids are perfectly safe for people who are suffering pain. What the researchers who made this statement were conducting research as to the effect of opioids on people with terminal illness or severe chronic pain.
Mm-hmm.
And what they found were these people were not they were not easily addicted to, for some reason I can't say big words today, but they didn't get addicted to these opioids,
Mm-hmm.
which kind of makes sense. I mean, if you think about it, they're facing cancer, they're facing severe chronic illness. Probably that's the least of what their body's going through.
Right.
So when that was published in 1980, these pharmaceutical companies took that New England Journal of Medicine research and ran with it and started promoting their pain pills as completely safe for
Wow.
doctors to prescribe. And even dentists were prescribing it for toothaches. I remember getting Percocet for a toothache years ago. And like I said, that's what happened with Taylor. When she was 6 years old and had oral surgery, that was her first exposure to any type of pain pill. So think about all those years that her body was kind of used to it. She'd built up a bigger tolerance to it over years. So that was probably the most shocking, that it was something so simple, taken out of context.
So who do you think is at higher risk?
Now,
Mm-hmm.
right now, at 18 to 25. Yeah.
So college,
College,
young adults,
young
they're at the
adults.
highest risk.
Their demographic raises about 16% each year.
Wow.
So there's SAMHSA estimated that we have 5 million of those kids that are in need of some type of substance use treatment. That's a lot of kids. And about 600,000 of those actually get help.
So what about the kids that, during your years in law enforcement, what about the kids who have parents that are addicted to drugs? Is there a common denominator with them?
Well, I don't know what you mean by
Like, how do they deal with this? Are they thrown into the system? What's life like for them?
Quite honestly, I didn't see that much of it. In law enforcement. We saw a lot of alcohol addiction, which is the same, to a degree. And usually, yeah, those children were thrown into the system. I spent a lot of years in crimes against children, so a lot of the children that I dealt with were abused, So I didn't see anything but abused children. So I can't honestly say that it was because of their parents' addiction that they were suffering from what they did. I mean, I'm sure that it is linked.
I read that in the U.S. Department of Health and Services, they did a survey in 2017. It says 11.4 million people misused prescription opioids or prescription drugs. 2 million for the first time. So it does sound like it's in a lot of cases it starts with prescriptions being misused, and which is kind of scary when I think about it. If I'm injured and I go to the doctor and he prescribes something for me, knowing in the back of my mind that I could become addicted will make me second, guess whether I should be taking it or not. Or if I do take it, when should I stop? Like, how do I gauge the appropriate time to stop so that I don't become addicted? So it's a scary thought.
It is.
Absolutely.
It is.
Why do you say that recovery should go beyond the 28-day cycle?
I get this a lot because when I first started doing this advocacy work, I was still pretty angry that Taylor's 30-day rehab program was not successful. And it was from a pretty reputable Atlanta-based institution that she was a patient at. But what I learned was, again, I was ignorant because I was like everyone else that thought I could just send them for 30 days and they're going to be cured. They're going to come out. They're going to be fine. And it actually doesn't happen. These drugs rewire a person's brain to a degree that their body absolutely has to have this to continue. That's what it's telling them. So this is not just a simple willpower issue, moral failing. This is someone whose body has been manipulated by this drug to the point where it's going to take a long time to heal. If you think about your body being injured, it takes a while to heal, right?
Right.
So this is something that is along those same lines. The other thing is a 28-day program is great for helping this person to detox. The first few days are the worst. There's vomiting. They lose control of their bowels, their bladder. They shake constantly. Someone that's going through withdrawals is horrible to watch. It's very painful for them. I remember Taylor just doing nothing but screaming and crying for hours. And when I'm the only one in the house with her, it got to the point where I wanted to pull my hair out, because, you know, 'cause I, there's nothing you can do for them. You cannot make them comfortable. But these facilities can make them comfortable in a way that's safe, you know? So it's great for that. And it's great for them to be introduced to the tools that they're going to need later after this 28, 30-day program is over. And then that's it. Their clinical treatment, that's it. So what we've learned, what research has told us, is that in order for any program to be successful, it has to have other components, such as a comprehensive support system. It's going to have relapse intervention. You're going to have to manage for relapses, which was surprising.
Wow.
It was one of the things that shocked me about the physician's health program that I've studied a lot, read a lot of the research that's been done on that program. That program is highly successful. They have an 80% success rate, whereas most rehab centers have somewhere around 20, 30, 40% success rate. So what are the physicians doing different? You know, what was different about their programs? Well, their programs were the same as the collegiate programs that I've also studied. They introduced that model of support. So here's peer support. Here's people that understand. There's no stigma. There's no shame.
Right.
They're okay with this. You can be open. You can be honest, but you're going to be held accountable for your actions. Also, these two groups have a lot of social capital. Think about it. Physicians have worked very hard to get to where they are. They've got medical degrees. They've got license that they're not going to give up that easily. So they're motivated to be successful in recovery. The same thing on college campuses. We've started to promote this person's social capital, give them social capital, give them something to work for. You know, we're going to work to get your criminal history expunged if you have one, which unfortunately most do, because like I say, they lie, they steal, they got to get money to get the drugs. So it happens. It's understandable. But we can work to get that fixed. We can work with companies who are going to not so much pay attention to that. They're going to be focused more on your success, recovery success, than they are what you did before then. So now we're going to help you get a degree. We're going to help you learn all of these social skills. They're going to make you successful in the future. So again, that's huge.
Right.
You know?
So it's all these steps.
Exactly.
Yeah.
And you have support through the entire program. You have someone that's with you the whole time, that understands, that's been where you are. And that's what's important about peer support, is these people have already recovered. You know, they're in recovery. So they know what you're going through, and they know what to expect. So they know how to help you. And then the other thing is they understand you're going to relapse. So they have a management system in place for these relapse. And that's huge. That's huge because it is going to happen. You know, there's some people that say successful recovery goes through 6, 8 relapse before they reach that point.
Wow.
That may be the case. You know, it may only take one. It may take none. You know, everyone's different. But they have a system in place for when and if that happens. And that's huge. So that's why these programs are so successful. And these 28-day programs are not. They don't have that.
Are they usually costly?
Very costly.
Okay.
Yeah. You look at a 30-day program, and in a good institution, it's going to run you somewhere around $30,000. Yeah. And I didn't even get called for Family Day. We were supposed to have Family Day, where the family comes and offers support to the person that's in there. And this was one of the problems that Missy and I had in common. We both shared, because Davis went to the same institution as Taylor. And she didn't get called for Family Day either. So there was no support system. That's why I'm not but they have their place. You know, it's clinical treatment, so they have their place.
You favor a different approach than what is normally the war on drugs. Explain that.
Kind of like a 28-day program. They just don't work. Look at the billions and billions and billions of dollars that we have spent on this war against drugs since the 80s. Has it been successful? No. We are worse off now than we were then. And one of the reasons that we're worse off is the pharmaceutical companies. So here's my thing. The war on drugs didn't work.
Right.
We wasted taxpayer dollars. We now have people clogged up in our prisons that don't need to be there because they got caught up in addiction. So now they have this criminal history that's going to follow them around. They're a felon because they possessed their personal stash. I'm not talking about drug traffickers. When I talk about the war on drugs, I'm talking about how it affects people who get caught up.
Mm-hmm.
Drug traffickers, listen, and here's the other thing that I can't believe it, and I figured this out when I was a law enforcement officer back in the 90s, which was one of the reasons I was never interested in the narcotics path, is because I saw that it was a vicious cycle. It's a $400-something billion industry. So once we put one trafficker away, don't you think someone's going to step up and take his place?
Mm-hmm.
Because they want a cut of that money. So we never had a shortage of traffickers, ever, and we're never going to. So my thing is let's take all that money and put it into these programs that replicate what colleges and what physicians programs are doing, and make these rehabs successful, make them, have all of these different components, which is going to cost money. It's going to cost money that most people don't have, So that's what I think we should do. I think we should, and you can't arrest, you can't arrest your way out of it. It didn't work. It's not going to work. And most of the jurisdictions in Georgia that I've seen have come to realize that. So a lot of them are taking a different approach. I mean, I don't know if you've heard about Marietta Police Department has pulled out of the narcotics unit that they used to be a part of. So it was a multi-agency narcotics unit that went after drug dealers and tried to get it off the street. Marietta pulled out, and they have taken a different approach. They're taking more of a harm reduction approach. So now what they're going to do is the human capital that they had invested in these in that narcotics unit, they're reallocating them to respond to people who have been revived with an overdose, to give them community resources and give them help to get them into a program.
Wow.
So that they can enjoy successful recovery as well. So that's what they're doing. They're going to dispatch those officers.
Wow.
Instead. Yeah. So, we're starting to take a different approach, but, still nationwide, we got some work to do.
So lately, all we hear about are all of the lawsuits against drug manufacturers. Do you think that they share some of the blame?
I think they share a lot of the blame. I think they share a lot. Like I said, when I was shocked to find out what started this crisis, I started digging a little bit deeper and read a lot of books and I read a lot of research. So I know how they manipulated doctors. I've read how they it's common knowledge because they've been successfully sued. I think Purdue Pharma's first settlement was $63-something million. I may have that wrong. To the state of Kentucky.
Wow.
So it was 2007. Most people don't even know about that one.
Mm-hmm.
They hear about these recent ones.
Mm-hmm.
That's nothing new. They manipulated these doctors. They took this research. They promoted their pain medicine as addiction free. It's not, you can't get addicted because it's time released and it's this and it's that and it's the next best thing. So doctors are pushing these pills like crazy, And now we have to dig out of what's been years in the making. And that's the other thing I get. It's like, we've had Naloxone for 5 years. Why aren't we any better? Why? We had 47,000 overdose in 2014. We're now at over 70. So why isn't it working? And I thought, gosh, it took us a long time to get here. It's going to take us a long time to dig up. 5 years is not going to do it. We're going to see a lot more deaths because we've got a lot of people that have been on these pills for years and years that are now getting the help that they need to recover. So it's going to take a long time to fix the mess that they've made. So yeah, I think that they should. Every time someone wins a lawsuit, I just smile.
Yeah.
And the state of Kentucky's done wonders with that money. They've built a pretty good system to help people who got caught up in the opioid addiction.
Well, speaking of Kentucky, I also learned, according to the National Institute on Drug Abuse, In 2017, it appears the East Coast seems to have more cases of death because of opioids. West Virginia, D.C., Maryland, Ohio, Maine, New Hampshire, Kentucky, to name a few, are at the highest risk. I recently read a New York Times article by Dan Levin. He spoke about a small town at the tip of Ohio. It's actually a county called Scioto, where it's farmlands, mills, small town, but they're calling it ground zero for opioids. There's a young girl there that they interviewed her. Her mom was addicted to drugs, and she would see her mom come in and out of rehab, come in and out of the house. And she talked about her story and her struggles watching her parent, go through this, and how she basically has become the parent because she doesn't know when her mom's coming back or if she's going to go into rehab. And I noticed that in reading the article, there were kids in this town that would go to school, and school was like their safe haven. They enjoyed going to school because they weren't around the drama at home. They were getting their breakfast and lunch at school, but weren't getting dinner because their parents were spending money on drugs. The teenagers were coming to school in clothes they've worn for days and getting a change of clothes, shampoo, but taking off the clothes and putting back on their old clothes before they go home because they didn't want their parents to take those clothes and sell them for drugs. So it's a sad story. And a lot of babies are being born addicted to drugs. So the teachers are having problems because they have severe learning disabilities. They're acting out in class. They're having temper tantrums and violent rages. So that alone, and considering also that Ohio doesn't spend a lot, they're the lowest in the nation on spending for child welfare. That's a sad story. They've got over 16,000 kids in foster care. So it really brings to light how you have a country like the U.S., prosperous, powerful, but then you have places within that are like third world countries.
Yeah.
Where does Georgia stand?
Getting better.
Okay.
Yeah, it's getting better. It still has it's still pretty high, statistically speaking, as far as overdose deaths. But we have Atlanta, which is kind of like the old Miami Vice. It's now Atlanta Vice. So you got a lot of drugs that are coming through Atlanta. We've got our own ground zero here, the Bluffs. Poor Atlanta PD has been trying to do something with that neighborhood forever. But it's getting better. I think last I researched, we were right around 15th. Okay. So, not great.
I noticed that too. We're somewhere in the middle.
Yeah, we're somewhere in the middle. The one thing that I always love to brag about Georgia is most progressive laws by far yet, considering what Ohio has gone through. And it's like the birthplace. I read Dreamland by a journalist. His last name is Quinones. I can't remember if his first name is Sam or anyway. He followed the opioid epidemic around and was one of the ones that said, yeah, Ohio's the worst, and actually became very close with in the Mexican cartel. He was able to get these guys to open up. And they talked about how they would follow the pain clinics around the U.S. So every time a pain clinic popped up, that is where they sent their heroin trade, because they knew as soon as the prescription ran out or they couldn't afford these expensive pills anymore, they could come with their balloons. And they actually sent their drivers out, like he called it in his book, like pizza delivery. He said it was like pizza delivery. They would put a whole lot of balloons in their mouth and just drive around. So whenever they got pulled over and the cops searched their car, they didn't find anything because it was in their mouth. They were Hispanic, so they didn't speak English, so they would just not talk if they got pulled over.
Wow.
It was a brilliant think about it. I mean, it's a brilliant business plan, right?
Right.
Follow around the pain clinics. But that's what they did. So Georgia came along when we introduced this 911 Medical Amnesty Act. And listen, when I first read it, I told them, I said, you guys are never going to get this past law enforcement. There's no way. You're talking about giving immunity to someone who has up to 4 grams of a solid substance, whether it's cocaine, heroin. That's a lot of drugs. That's a lot of drugs. So you're never going to get this to happen. They're like, well, we got to try. It's like, you guys are great. You guys, I like it. So it passed. It passed as written. And it was
Wow.
shocking. And I read a lot of the other laws around the U.S. at the time, and the most I read was up to 1 gram. So, and then Georgia came along with 4 grams. Georgia came along with probation, parole. We granted you immunity, literally blanket immunity, regardless of what situation. And I went to a North Carolina session. I was invited to speak with some of their legislators up there about Georgia's law. The night before, I met with some of their law enforcement, and they were like, "Y'all are crazy. We're not going to pass that kind of, we're not going to pass that kind of law. It's too much immunity. It's too much blanket. It's taken away too much, the crime factor involved." And I say, who cares about the crime? Would you care? If it was your 18-year-old daughter that was addicted to heroin, would you want her life saved, or would you want her arrested for probation violation?
Right.
What's more important?
So as a parent that's been through this, do you have any tips for parents to keep their kids safe?
Listen to your kids. Listen. They know it's going to be the hardest thing that you will ever do, to have that tough conversation, but you've got to have it. I had a brilliant opportunity with Taylor to learn so much from the inside what was going on, and I just didn't listen because I thought I knew better. I was the parent. I was the police officer. I've seen bad. I've seen evil. You're just a kid. You listen to me. I know how to help you. I know what to do. I know who to call. And we would have knockdown drug. I would just screaming fits. I thought for sure our neighbors were going to call the police on us a couple of times because she would just get so frustrated. And she said, listen to me. Listen, I can't do this. It's hard, Mom. 10 days before she died, I often take this text around because I do some teen intervention for Forsyth County Sheriff's Office. They have an amazing program up there. So I often take her text message with me. And it was the last opportunity that she gave me to listen to her. And it was 10 days before she died. She had just been released from Kennesaw Hospital after an OD where she had flatlined, and Metro ambulance brought her back. I didn't even know that she was in the hospital because she was 20. She was an adult. So if she said, don't call my mom, there's nothing they could,
Right.
nothing they could do. So she called me when she got out and told me that she had OD'd, told me what it was like. She talked about dying. She talked about seeing the paramedics work on her. I mean, she told me amazing stories. We sat on the phone crying for an hour. And then I did the same thing that I always did. I still, in that 2 years, had not learned my lesson to shut up and listen. I said, this is what we're going to do. I'm going to quit my job. We're going to move because I had family in Florida. We're going to move to Florida. We're going to move away from all of this. And she was like, Mom, I'm still going to crave heroin. Moving is not going to make me feel better. Yeah, it's going to take away the ability to get the drug, but Mom, I'll find it there too. Listen to me. Listen. So we had another screaming match that ended in hanging up. And that's what she did. She couldn't take it anymore. She just hung up on me. And I did the same thing I always did, call her right back. Don't you hang up on your mother.
Right.
Oh, cut your phone off. That kind of thing. So she sent me a text. And she said, listen, my body is done. If I ever do drugs again, it will be the last time.
Wow.
I can't fight it. I don't know if I can say no. If I'm around him, I don't know if I can say no. But I still want him. I'm still craving him. I got to figure out how to do this on my own. And that was her way of saying, you're not going to listen to me. That's just what she would do. She would always say, I'll do this on my own, Mom. I don't need you, you know. And she said, I want you to know this. You've done everything that you could do. It's on me now. And, you know, you've been a great mom. Thanks. And 10 days later, she was dead. So it was like my last opportunity. And I take that around to show parents to listen to your child. If they're telling you that their body is craving this drug and it's not a matter of a choice to them, it's not a matter of willpower or just saying no, listen to them. And you need to step up the help that you're going to give them. You know, you need to start looking at programs that are distance programs that are, you know, 100 miles away from their friends, from their family, but have that support. And you got to be there, you know? You got to be ready to listen to this, and you've got to be ready to hear that your child is an addict. It's not a moral failing. It has nothing to do with what you've done as a parent. And that was the hardest thing for me. I was like, I'm a cop. Come on, you know? She had a great life. She had a fantastic childhood. She was so well loved. She was the baby sister of 3 older sisters who she was like their toy, you know. She got everything she ever wanted. I mean, she earned it. Don't get me wrong. She wasn't a spoiled brat. She had parents that loved her. She had a great life, you know. So it wasn't her moral failing, and it wasn't mine. It was just how it ended up.
Right.
You know, her body became addicted. So it's tough, but listen. And one of the things that's always surprised me, and this surprised me even when I was in CID, how parents talk about their children's room as if it's private space. So I tell the story because it's just an example of what we still do. And this was many years, and it's getting worse now. So I went to a runaway child's home. Parents very upset, beside themselves. The child was 13, 14 years old. I don't remember, young teenage. So obviously didn't get in a car and drive away. So they're very concerned. And I said, well, have you searched her room? Let's go search her room, and let's get some phone numbers. And the parents said, we can't do that. That's her room. I said, what? No, it's not her room. It's your room.
Right.
She's borrowing it. You give her.
That's right.
You're giving her this space to use.
Right.
Let's go search. Let's go look through her diary. Let's go look through her journals. Oh, no, I can't do that. That's an invasion of privacy.
Oh, no.
So you've got to be ready to invade your child's privacy. You've got to be ready to ask questions, know their friends, watch for the signs. You know, if your child starts to lose weight, if you have a child that has a very gaunt appearance, they're starting to, you know, their eyes are sunken in, their skin's taking on a yellow hue to it. Ask some questions.
Yeah.
Don't listen to, oh, I'm just stressed out. I've got a lot of exams coming up. I'm just tired. No, that doesn't make you look like that. So
Investigate.
And you've got to be ready to be very, very evasive in their lives. You know, I wish I would have followed Taylor. You know, I wish I would have done a lot more than and I had some great eyes in the community because I had a lot of law enforcement officers that were friends of mine. They knew her, you know?
Right.
It wasn't, she was well known. So I would still get phone calls and I would still listen to Taylor. Oh, well, they're just being mean. They just don't like my friend's mom. Okay. You know, because you want to believe your child.
Right.
No, you gotta stop that. You gotta turn that off.
Okay.
And you've got to be ready to have some very open, honest, difficult conversations. Usually, a lot of times, children who are going through drug use, whether it be experimental or whether they are in addiction, will try to turn that back on their parents. Didn't you ever try drugs? Didn't you ever use drugs? If the parent drinks a lot, they're going to use that. So, be ready to answer them honestly, but redirect that conversation back to what's going on with them. This isn't about me. I survived. I'm still here. I'm successful. I'm doing this. I'm doing that. This is about you, and this is about your problem. So don't let them bait you into that conversation. But just be ready to do that. Another thing that's shocked me through this journey, and I don't know if it really, I guess it shocked. I can't really say it shocked me. I understood to a degree. Is I hear a lot of parents say, I don't want to talk to my child before they're in high school. I don't want to talk to them before they're in middle school about drugs because I want them to retain their innocence. And I've heard that exact phrase. I want them to remain innocent as long as possible. So here's the story that I tell them. When my children were very young, I was a criminal investigator. I was investigating persons crimes, rape, robbery, murder, child abuse. I saw a lot of bad things. So I started talking to my girls about stranger danger and taught them that a stranger is usually very nice, grandpa-ish looking, grandma-ish looking person, have candy, and they'll have puppies, and they'll be so sweet, and they'll tell you that they know me, or they'll tell you they know their dad, all of these things. They will look really sweet. They will not look like the boogeyman that we have imprinted in your mind,
right.
Stranger, be afraid of these guys. So I taught my girls that. So sure enough, my oldest daughter, Gabrielle, was right around 8, so Taylor was probably around 6. They were playing in my front yard. I had my screen door open with a clear view of my front yard, and I had the sidewalk and then the street, right? So they're playing and a car pulls up. I don't see this because I'm doing my thing in the house. I don't see this. And the gentleman in the car rolls his window down, asks Gabrielle to come over and ask her because he needed directions, needed to know. I think she told me that, ask if she knew a certain person in the neighborhood. Do you know so-and-so? I'm looking for their house. Can you help me? Trying to get her to come over to the car. Gabrielle did exactly what I taught her to do. She grabbed her sister's hand, screaming at the top of her lungs to get as much attention as she possibly could while she ran to the house. And I had told them exactly to do that. I said, even if let's say that, you're at the babysitter's house or your dad's house, and the closest person is a neighbor, run screaming, make as much attention as you can. Yeah. So she did that. Okay, she did exactly what I told him to do. I never talked to them about drugs.
Wow.
I never had a conversation with either of my girls about drugs.
So starting the conversation early. Chances are they already know some things.
Chances are.
Yeah. Absolutely.
They know a Johnny or a Susie who's brought their mom or dad's pills to school. Mm-hmm. We've seen it. We've seen it in elementary school. So my advice to parents is don't let someone else take your child's innocence away. If it's going to be gone, let it be on your terms.
Right.
Not someone else's.
Let you control the scenario.
Yeah.
Absolutely.
Yeah, just like I controlled the stranger danger, and it worked. So what if I'd have done that? What if I'd have had that conversation with them about drugs?
Thank you so much for the advice. Thank you for being so candid.
You're welcome.
I'm so glad that you came today. And thank you for your law enforcement years. Thank you for your service.
Oh, you're welcome. Thank you for saying that.
So be sure to find Raising Mommy anywhere you listen to podcasts. Check out new episodes every Saturday. Follow us on Twitter at RaisingMommyGA. Search for me on Facebook and Instagram at eatplantsforlife.com. or Raising Mommy podcast. If you know someone or if you are someone who needs to talk to someone about drugs, you can reach the National Drug Helpline at 1-888-633-3239 or the Substance Abuse and Mental Health Services Administration Helpline. It's open 24 hours a day, 365 days a year at 1-800-662-HELP. As always, thanks for listening.